to all of you. I introduce myself. I am Francesco Maraglino. I am a medical doctor. I am a specialist in healthcare statistics, and then also a high-level postgraduate training in public health, healthcare management, and epidemiology. And I'm really happy to start this event that is the public launch of the legal preparedness action packages in the global health security agenda. So first of all, I will ask to Julie Fisher from the Advocacy and Communication Task Force to say some housekeeping rules. So Julie, please.
Thank you so very much. I appreciate that. So welcome to the public launch of the Legal Preparedness Action Package. I just, as was mentioned, have a few housekeeping remarks. First, I would like to notify everyone that this meeting is being recorded so that it can be used and accessed later by those who are members of the Global Health Security Agenda and by the larger stakeholder community. Please share any questions that you have at any time by placing them in the chat box. This is a very large group, and we would recommend highly that you please place questions as you think of them in the chat box, and they will be monitored by our moderators, who will ask them of the speakers and panelists. I would like to please remind you to be aware of your microphones and to make sure that you are on mute if you are not an active speaker. And then finally, I would like to inform you both that there is a hashtag for this event if you are using social media and you would like to share your observations by Twitter or other social media before and after the event. I will drop that into the chat box, but it is hashtag legal preparedness. And then finally, I would like to please invite everyone who is on this call to join us in a silent roll call by placing your name and your affiliation in the chat. That will again be captured to make sure that you're receiving all of the messages from this task force moving forward. Sorry, this action package moving forward. So thank you very much. That's the conclusion of our housekeeping remarks. And now I turn it back to our moderator and host.
Thank you very much, Julie. So I formally welcome all the participants on this event. I know that there have been more than 300 people that subscribed to this event, so it's really, really happy about this. And the first thing that I want to say is the fact that this year Italy, my country, is chairing the steering group of the Global Health Security Agenda, and it is an important year for this agenda that I remember is a group of more 70 countries, international organizations, non-government organizations, and private sector companies that have come together to achieve the vision of the world safe and secure from global health threats posed by infectious disease. And the steering group is a 15 country steering group, and we are chairing this year. And in particular, as a chair, we support a lot these specific action packages on legal preparedness, because it's really clear that many of the topics, legal topics, are really important in this specific time of pandemics and of health emergency. Think about the importance of the legal and the ethical implication, for example, of the imposing not pharmaceutical measures, and then also about all the discussion about mandatory vaccination, but also all the implications that are very important in the supply and the financing of this pharmaceutical and non-pharmaceutical measures. We are in a period in which all the legal framework after the pandemic on the are changing at the WHO and planetary level. For example, the discussion on the IHR, on the new IHR, the pandemic treaty, but also on the European level. We are a country that is present in Europe, and of course there is a very big packages of new laws about the preparedness in the European Union, on which all the member states and the European Commission are working on it. So I really think that this topic of legal preparedness is really important. It's important for us as a chair. So what I have to say, to thank for again the Advocacy and Communication Task Force for hosting this launch, for its support on planning the event, and also for the support on its support on the legal preparedness action package, and for helping to moderate today. But thank you very much. So I have already in some way introduced this action package, but I want to mention the co-chair or the co-chairs of the action packages, that are the United States, Argentina, and the O'Neill Institute. So thank you very much to the co-chairs for their work. Saying that, and talking also about Argentina, I have to introduce the first speaker. The first speaker is Dr. Carla Moretti. She is the National Director of International Affairs in the Ministry of Health of Argentina. She is graduate in political science in the University of Buenos Aires, and has a specialization both in health security and public health and international relations. And she is in her position in the Ministry of Health of Argentina as National Director of International Affairs since 2019. So Carla Moretti, Dr. Moretti, thank you very much for being here, and the floor is yours for your remarks. Thank you.
Thank you, Francesco, for your words, and good morning, everyone. It's a pleasure for me and for Argentina Ministry of Health to welcome you to this formal public launch of the Global Health Security Agenda Legal Preparedness Action Package. I would like first to congratulate Italy for taking on the role of GHSA chair. I would like also to take this opportunity to thank the O'Neill Institute, the CDC, and the Office of Global Affairs of U.S. Department of Health and Human Services for all their hard work on this package. Argentina considers that the establishment of this action package represents a way to address the major gap. Argentina considers that the establishment of this action package represents a way to address a major gap in public health emergency legal preparedness. We are committed to support global efforts to build national capacities in order to better prevent, detect, and respond to the national spread of disease. In this regard, we are sure that working on legal frameworks at both international and national level can empower governments to strengthen public health and preparedness systems. Argentina believes that the international health regulations represent a key cornerstone for global health preparedness and response. Therefore, all efforts should be aimed to ensuring its compliance and implementation, and supporting countries for strengthening their national capacities. Argentina went through his first external evaluation in 2019, understanding that it is a voluntary process that promotes transparency and assesses countries' capacity to better prevent, detect, and respond to public health emergencies. Among others, we have identified potential lines of action on legal preparedness, which will enable us to increase our capacities and reduce exciting gaps by reviewing our current legal frameworks. We believe that many of the recommendations on legal preparedness that the experts have pointed out are shared by many countries in the region of the Americas. Based on our lessons learned, we truly hope our experience can help other regional countries to follow us on the GE process to evaluate exciting laws that may facilitate IHR implementation and compliance, and to develop a national action plan for health security. Argentina has has joined the Legal Preparedness Action Package because we truly believe that our country can empower its national preparedness and response capacities and thus benefits other regional countries by guiding the way. Therefore, we invite you to all to participate in our package. Thank you.
Thank you very much. Thank you very much, Argentina, thank you, Dr. Moretti, for your opening remarks, and thank you very much for the support. So I will give you a very short overview of the agenda, because after this welcome remarks, we will let a keynote speaker in a session that will be moderated by Sandro Bonfigli. Then we will have Dr. Anan Amza address that will moderate two sessions, one with introduction of the Global Health Security Agenda Legal Preparedness Action Package, and then what is legal preparedness. And then we will have a roundtable on the challenges of the legal preparedness, and at the end, the closing remark from Jose Fernandez from the United States of America. So now I introduce Sandro Bonfigli, who will be the moderator of the next section. Sandro Bonfigli is from the Italian Ministry of Health. He's a statistician. He has 20 years of experience in infectious disease field. He works in the Ministry of Health in infectious disease office, but before he also worked in the National Infectious Disease Institute. It's an hospital in Italy, in Rome, for specialized in infectious disease. And then also in ECDC, the European Center for Disease Control and Prevention. And he always deals in our unit with international affairs in European Commission's Global Health Security Agenda and Global Health Security Initiative. So Sandro, please, the floor is yours.
Thank you very much. I will restrain myself to say how much we do share the importance of this group, both as a chair of the current chair of the Global Health Security Agenda Steering Group and as a member of the action package itself. So as we have really not so much time, and we have the luck and of having such a distinguished keynote speaker, because we have Anthony Brown. He is the Vice President and General Counsel at Resolve to Save Lives. But in addition to this, his activity during the last more than 15 years of his legal career is really focused on the themes of this meeting, because prior of joining Resolve in 2021, he was the senior legal counsel at Gavi Alliance in Geneva when he supported their efforts to develop vaccine markets. In addition, he was involved in setting up and operationalizing Gavi flagship financing mechanisms. And building on this experience, Anthony also led the legal efforts to establish COVAX. And he also serves on the board of the Global Health Security Council. Say that it's evident that I do not have to waste more time, and it's a pleasure to give the floor to Dr. Anthony Brown.
Thank you very much. And good morning, good afternoon, and good evening to all of you. Let me tell you, I see my role as a keynote speaker somewhat like a seat warmer. I'm meant to prepare you for what is to come. I've taken this responsibility seriously, and I hope I can do just that. I'm going to start with the headline of an article from the New York Times. It says simply, "We must prepare for the next pandemic." The article was written in June 2019. This is just one of numerous articles written before the current pandemic, speaking to the fact that a pandemic is inevitable. We knew it was coming, but nonetheless, we were not ready. This action package is about legal preparedness, and we will hear a bit later exactly what that means. But in my role as a seat warmer, I'm actually going to talk about what it means to be unprepared from a legal perspective, both globally and nationally. And this is from the perspective of a lawyer who worked to establish a global initiative to help in the development, contracting, and dissemination of vaccines. So much of my discussion will focus on this area. The world was unprepared for coordinated legal action. In the early crisis period of the pandemic, there was recognition that the world needed to come together to facilitate innovation, research and development, manufacturing and procurement, and contracting of medical countermeasures, and that ultimately there would need to be facilitation for equitable access to these medical countermeasures, particularly vaccines. But there was no multilateral organization that existed with this mandate, with a governance structure or with legal agreements with countries already in place. There was, in fact, no legal basis for countries across regions to immediately come together and start negotiating and contracting with manufacturers. Gavi started to have conversations with WHO and CEPI on an initiative to fill this role, COVAX, as you all know. To bring COVAX to life, we had to find it a legal home, develop a governance structure that allowed for fair representation and included all the necessary policies and procedures, and develop common legal agreements intended to be used for over 90 sovereign nations. And this all had to be done within a few months. During the establishment phase of what was meant to be the global initiative, individual countries and regional blocs started to negotiate their own bilateral deals with manufacturers, which led to severe disparity in early access to vaccines, which continues to this date. Other ways in which the world was unprepared for coordinated international action include challenges with countries imposing travel restrictions, challenges with ensuring vaccination of displaced individuals. And while there were calls and agreement clearly on global solidarity, there seemed to be disagreement over what global solidarity meant. On one end of the spectrum, it meant cooperation and transparency, while on the other end, it included global equity in vaccines disbursement and COVID-19 vaccine intellectual property waivers. Let's move to the national level. Many countries did not have any laws and regulations in place to be able to operate flexibly under a pandemic emergency situation. As an example, even to be able to join COVAX or as part of their bilateral deals with manufacturers, some countries had to pass exceptional legislation waiving their procurement rules, just to name one area. But honestly, the main area where countries face significant legal challenges in efforts to purchase COVID vaccines was negotiating the issue of liability and indemnity with manufacturers. Manufacturers required countries to be responsible for litigation arising from serious adverse events following vaccination. Without already having legislation in place that allowed a country to make decisions quickly under a pandemic emergency, the passage of such legislation took months from some countries, significantly delaying access to vaccines. The legal technical capacity for these types of negotiations with manufacturers does not exist in many Ministry of Health or Ministry of Finance departments, where these very commercial negotiations with manufacturers were taking place. In my numerous discussions with countries, questions around indemnity came up often. Some manufacturers were also insisting that countries establish systems to compensate individuals suffering injury following vaccination. It should be noted that often the laws passed by countries are exceptional and apply to COVID-19 only, which means they will not be valid for the next pandemic, which is probably right. Laws should be written during periods that allow for debate between all stakeholders and thorough consideration of the implications. To conclude, the world was unprepared to be able to undertake coordinated global action and to agree and understand what that means and should look like. Individual countries were unprepared in being able to quickly negotiate deals with manufacturers due to the lack of flexibility in laws. So I'll end where I started, with a headline from an article. This one is from Time magazine from May 2017. The world is not ready for the next pandemic. And I would just like to add, but we can be. Pandemic legal preparedness should not be an option or a nice to have. It's a critical component of identifying and responding to to a pandemic and making sure that the next pandemic looks very different than the current one. Thank you. And with that, I'll turn it back over.
So thank you very much. We have the time for one or two questions. I don't see any question in the chat. I have to, I'd use this time to thank Dr. Brown to remember the importance of this theme, because I mean, for we, as you heard, are technicians. We work in the infectious disease field, at least me, and it's clear that the norms are a tool to protect life, to avoid diseases and suffering, and to use the resources in the best possible way. In the meantime, I still see participants, and I do not see any question. Probably you touched us in a way that avoided restraining the public for asking some any further comment. Given that, I would, as we already a bit late on the timing, I thank really much Dr. Brown, and I would introduce the, sorry, I see one last moment question, which is interesting because from Iraq, they're asking if there is any global plans to monitor legal frameworks regarding public health and infectious diseases in different countries.
Thank you. I think the question, maybe one of our later panelists can address the question, but as a practitioner, I'll leave it for one of our later panelists, and I think let's maybe hold it for the moment.
Yeah, I do agree, and I see some interested faces in the next panelists that are thinking about the answer. So I do agree with you. So again, thank you very much, and now I will introduce the moderator of next session. Which is a pleasure for me, because the next session will be moderated by Dr. Hanan Idris. She's an advisor to the Deputy CIO of the Public Health Authority, Wakaya, which is in the Kingdom of Saudi Arabia. This was previously known as the Saudi CDC. And the Kingdom is leading the GHSA Task Force on Action Package Coordination, which oversees 9 action packages, including this one, the legal preparedness. And Dr. Idris holds a doctorate degree in public health from Johns Hopkins University, Blomberg School of Public Health, where she also serves as a faculty member. She holds a master's degree in health system administration from Georgetown University, and all the people that attends the different meetings of GHSA can attest how the work of the task force and of Dr. Idris is really important to make all the things go on. The task force and she in particular are really helpful and fundamental. So it's a pleasure to introduce Dr. Idris.
Thank you, Dr. Sandra Bonfili, for the kind introduction. The session is, the upcoming session is titled Introduction to the GHSA Legal Preparedness Action Package, and it'll last for approximately 15 minutes. We heard earlier today a little bit about the global health security agenda from our colleagues in the GHSA Italian Secretariat. It's a group of more than 70 countries, international organizations, non-government organizations, and companies in the private sector that have come together to achieve the vision of a world safe and secure from global health threats. As one of the task forces within the GHSA community, the Kingdom is leading on the Task Force on Action Package Coordination. Action packages are multi-stakeholder, multi-sectoral working groups that focus attention towards specific GHSA objectives and targets. The role of the task force is to coordinate the work of the 9 action packages, namely surveillance, workforce development, immunization, zoonotic diseases, sustainable finance, laboratory systems, biosafety, biosecurity, AMR, and the newest action package, legal preparedness, which is a critical component of the health security efforts as it facilitates the prevention, detection, and rapid response to public health emergencies. Before we start the session, I'd like to congratulate my colleagues in the Legal Preparedness Action Package on all the hard work and planning that was done in order for us to get to this launch. The Action Package is truly a great addition to the GHSA. So today, I'm honored to present to you the distinguished leaders of the Legal Preparedness Action Package. We will hear today from Ana Ayala. She is the Senior Global Health Officer at the Office of Global Affairs in the U.S. Department of Health and Human Services. Ms. Ayala is a global health lawyer and leads legal preparedness efforts for the Office of Global Affairs Pandemics and Emerging Threats team, and has contributed to the legal aspects of the COVID-19 response. She supports the development and implementation of U.S. global health security policies and the strengthening of international partnerships. She manages the U.S. International Health Regulations, IHR, National Focal Point Program, and has led coordination efforts across the U.S. government to develop the country's national action plan based on the 2016 U.S. Joint External Evaluation to strengthen IHR implementation in the U.S. Ms. Ayala holds a Master's of Law degree from the Global Health Law from Georgetown University, a law degree from American University, and a Bachelor's of Arts degree in Anthropology and International Studies from the University of Chicago. We will also hear from our colleague Sam Halabi. He's a senior scholar and visiting professor at the O'Neill Institute, where he leads the Institute's Center for Transformational Health Law. He is also the Senior Associate Vice President for Health Policy and Ethics at Colorado State University and a professor at the Colorado School of Public Health, as well as an affiliate researcher at Georgetown Center for Global Health Science and Security. Professor Halabi advises or has advised on COVAX Facility, the World Bank, the World Health Organization, the National Foundation for the Centers for Disease Control and Prevention, and the Global Virome Project, among other national and international organizations. Previously, he practiced law at the Washington, D.C. office of Latham & Watkins and clerked for Judge Nanette Lawfrey of the U.S. District Court for the Western District of Missouri. And finally, Pia Valentini. She is an advisor at the National Directorate of International Affairs in the Ministry of Health of Argentina. From 2017 to 2019, she worked as an advisor at the Ministry of Health of Argentina under a project financed by the International Bank for Reconstruction and Development. Ms. Valentini is a graduate in political science at the Catholic University of Buenos Aires and specialized in management development. Colleagues, the floor is yours.
Thank you very much, Dr. Redress. It is really a pleasure to be here with you all. This is certainly a great opportunity for us to bring greater awareness to you about legal preparedness and also introduce to you our action package. But first, on behalf of the action package, we'd like to take this opportunity to thank the GHSA chair, the Action Package Coordination Task Force, and the Advocacy and Communications Task Force for their support in the promotion of the action package within GHSA and more broadly. We are a young action package in the GHSA family, and yet we're already seeing how the different components of GHSA can benefit and help further our mission. And this event being a major example of that. And today I will be speaking on behalf of the US leads in the action package. The Office of Global Affairs and the CDC have been working very closely together and arduously from the very start to raise awareness and promote the importance of this issue and initiative within the US government. And of course, to support the work of the Action Package's leadership team. It is also my pleasure to be able to present this overview with representatives of the other co-chairs of the Action Package, Sam Halabi and Pia Valentini. Argentina and the O'Neill Institute have contributed tremendously to the creation of this action package, each bringing their own perspectives, resources, and talented staff to make the action package a reality. And also the leadership team is absolutely thrilled to be able to feature some of our members in this important event. I should mention that we have many more in the audience who will be featuring throughout our events in the future. As you will see today, our group has a diverse composition, with each member bringing a different perspective and experience. And with that, I will now begin our introduction to the Legal Preparedness Action Package. So we are driven by our mission to promote legal preparedness as a critical capacity for an effective public health emergency response and for strengthening global health security. With a vision that one day, legal preparedness will be globally recognized and understood as a critical capacity for effectively responding to public health emergencies and for global health security. As Pia will later highlight, we bring together key experts from across sectors and geographic regions and their different efforts, where no centralized multi-sectoral platform on legal preparedness existed before the action package. Through our collaboration, we can trigger greater interest and a common understanding of this key capacity so that countries, regions, and the world can become better legally prepared for the next emergency. Next slide, please. Through our work, we plan to build a solid foundation as well as a common understanding of what is needed for legal preparedness, to develop technical tools to guide and support countries in strengthening this capacity, and to advocate for greater awareness globally about the role that legal preparedness plays in preparing for health emergencies. And to achieve this, we developed these strategic objectives, which fall under 3 separate but interrelated work streams: outreach and advocacy, guidance tools, and capacity building. The work streams of outreach and advocacy will be key to bringing greater awareness on both the issue and the work of the Legal Preparedness Action Package. And over the course of the Action Package's work, we will continue to identify and engage relevant stakeholders across multiple sectors and geographic regions that are not yet part of this working group and that can be valuable to the work. This work stream is also where we work towards using our high-level channels to bring greater awareness and garner support for legal preparedness from political leaders. And we want to bring multi-sectoral awareness and support at various levels, whether we're talking about political, technical, global, regional, national, subnational levels, so that legal preparedness is recognized as a critical public health capacity. We also see the important role that this action package can play in identifying resources and facilitating connections between countries and potential funders to support implementation of legal preparedness recommendations developed by the action package and other efforts. Now, the guidance tools workstream encompasses all those activities that are about defining capacity and its different aspects, as well as identifying the gaps that currently exist to provide guidance to the global community on the various aspects of legal preparedness. Through the outreach and advocacy workstream, we will be able to promote these tools broadly. And so this workstream's objectives are to define public health emergency legal preparedness, its relation to other areas of law, and the importance of legal preparedness at every level, country, regional, and global, to achieve global health security outcomes. And to also build technical tools, including by leveraging existing ones, some of which may have been developed by our members, in order to guide countries in improving their overall legal preparedness. And finally, under the capacity building workstream, we envision activities that will build on the work developed under the guidance tools workstream and translate it into capacity building platforms and materials that can be later shared with countries to support their training to become better legally prepared. Through these efforts, we can leverage and complement existing tools and efforts that our members developed, are developing, and will develop. In short, this workstream will allow us to translate our work into tangible impact on the ground and advance GHSA's mission and current target. So our strategic objectives in this particular workstream are to identify and leverage existing efforts and tools to develop, refine, and bring to scale approaches to build country capacity, and to establish a global learning network to build at the country, regional, and global levels using a variety of platforms, such as virtual courses, collaborative webinars, in-person trainings, etc., to expand legal preparedness competencies. And now I will turn it over to my colleague Pia Valentini to continue with the presentation.
Thank you, Ana. Thank you and hello everyone. So why GHSA? This important slide aims to convey the convenience of framing the action package within the GHSA platform and the benefits of this partnership. The GHSA Global Health Security Agenda is a multilateral and multisectoral partnership comprised of more than 70 countries, international organizations, foundations, and businesses to strengthen global health security. It's one of the most important global platforms in galvanizing stakeholders around the world to strengthen countries' capacity to prevent, prepare for, detect, and respond to global health emergencies. So why GHSA? Seeks to support country-level capacity building for health security, provides the necessary global and multisectoral platform focused on GHS to promote legal preparedness at the global scale, including fostering political support and the technical and policy levels. Allows for the flexibility to combine a wide range of experts from around the world, including global health law experts, public health experts, international organizations, and government officials, and foster multidisciplinary collaboration. Next slide, please. On this slide, we can see the current legal preparedness working group members, which are listed in 3 important group categories: countries, multilateral organizations, and civil society, including academic partners. It is really important to highlight the benefits that arise from having a multisectorial and multidisciplinary group of experts. Countries bring in their experience and ability to think practically, as well as the capacity to promote and effect change within their own countries. Multilateral organizations bring in the global perspective and experience in working with many countries on challenging health security issues like legal preparedness. They also offer experience in capacity building. Academic partners are critical to help us think and define this field. Thank you, everyone. And now I turn to our colleague, Sam Alavi.
Good morning, good afternoon, good evening, everyone. It's heartening to see so many friends and colleagues gathered here with whom I and others in the leadership have worked over the last 2 years. My role today is really to just sort of articulate the structure of the action package and sort of identify or define the sub-working groups that have been formed so far and what some of their current work is. So the action package in many ways was the model of inclusiveness and deliberation. We owe a great deal of thanks to Dr. Idris, as over the summer, this sort of coalition of partners who had identified real gaps in legal preparedness and for whom it had been a priority for so long came together and really thought that the GHSA was the appropriate forum to address those gaps. So the action package operates within the broader GHSA. It's led, as you've already been told, by the Ministry of Health of Argentina, by the Office of Global Affairs at the United States Health and Human Services Agency, and by the O'Neill Institute. We view it as a real strength of the action package that the O'Neill Institute plays a kind of leadership role as an academic institution, as a technical support organization. It's really able to sort of execute and coordinate in ways that many people in government just sort of, they don't have one more thing that they need to do. And many of you have been contacted by Kat Ginsbaugh for whose relentless commitment and sort of strength in sort of shepherding us all has already been one of the remarkable parts of the action package. So I want to make sure to just take a moment and acknowledge all of her work and diligence. So Anna already articulated the workstream formation. Again, you saw on the list of partners that this is a truly inclusive and deliberative process. I want to talk a little bit about the sub-working groups that have been formed so far. So you see them on the slide as legal mapping, liability and risk management, and then outreach and advocacy. This isn't an exhaustive list. There are more sub-working groups that will be formed, but these, again, through an inclusive and deliberative process, are the ones that have been prioritized. used. So legal mapping is led by the United States Centers for Disease Control and Prevention. They bring decades of analysis and support worldwide in an effort to sort of identify where the gaps in national legislation, or in the cases of regional systems, regional approaches are, how to gather data, how to inform rule of law-based processes to adopt legal authorizations, to identify priority areas, and to work within government structures to make sure that countries are prepared, or countries are prepared within regions. Liability and risk management is focused on medical countermeasures and all of the legal authorizations and processes that are needed for vaccines, therapeutics, and diagnostics to flow equitably and efficiently to the places where they're needed most. So that includes sort of indemnity and liability provisions, liability risk management mechanisms, insurance markets, and then compensation mechanisms, which upon which I've worked with so many of you for the last 2 years. And then finally, outreach and advocacy, which is our sub-working group that's aimed at identifying partners within GHSA and then external to GHSA. It includes building the secondary literature, so publications on the theme of legal preparedness, which in the process of forming the action package we found to be scant, and for which so much work is left to be done. So I'm going to close there. And again, thank you all for attending on what we think will be a really high impact endeavor within the GHSA.
Thank you, Anna. Thank you, Pia, and thank you, Sam. Appreciate your presentation. So just to summarize, today we heard about the Legal Preparedness Action Package in the GHSA and its role and mission. We heard about the memberships that's made of countries, multilateral organizations, and civil society, as well as academia. And we also heard a little bit more about the working groups and the work streams. So the working groups, or the sub-working groups, are legal mapping, liability risk management, outreach, and advocacy, as well as the 3 work streams that were highlighted that include guidance tools, capacity development, outreach, and advocacy. So we have a few questions here in the chat. One of the questions that we've received earlier was, what legal strategies can we employ to protect public health from partisan politics? We've seen in the COVID pandemic that partisan politics was very detrimental to the response and sometimes even overruled scientific advice. And then we also have a couple more questions. So I'd like to pass it over to the presenters for their response. Thank you.
Well, I can start on Ryan. Some of the big, oh, Sam, it seems like you want to add as well. But, you know, there are a number of challenges that we face. I mean, obviously political ones are one of them when we're talking about public health emergency response and preparedness as well. And so one of the benefits I think that law plays is that it can create and potentially minimize, right, some of these challenges that we might be able to see. That is the benefit of the law, right? That is a way that you can make sustainable change, that you can, you know, you're not talking about just policies, you know, that depending on who might be in governance or et cetera, you know, might undermine, et cetera. At the very least, you know, laws kind of create some level of a backbone to some of the things that are needed, such as, you know, legal authorities when it comes to certain aspects of preparedness and response. So that is one way that this action package, you know, in its promotion of the use of law and the critical role that law can play when it comes to really addressing some of the challenges that come before us, whether we're talking about political or otherwise. Sam, do you want to add to that?
Only to say that, you know, sort of that even though it's framed in terms of partisan politics, sort of communication preparedness is part of legal preparedness. So, you know, I think almost every government was unprepared to have a coordinated legal communication strategy. That's part of the effort of the outreach and advocacy sub-working group, but it is certainly on our radar, and that is something that needs to be addressed for sure.
Thank you. Thanks to Ian Gonzalez for that question. For the interest of time, I'll quickly also mention that there are 2 more questions in the chat, and then perhaps we can wrap up the discussion. So we have a question from the Ministry of Health in Iraq. Are there any global plans to monitor legal frameworks regarding public health and infectious diseases in countries? And then we also have a question from Dr. Rasha Salama. Health and non-health legislations are required to face the pandemic used complementary to each other. And if there's an example to be shared with the audience, it would be appreciated. Thank you.
So I would turn actually, and this is an opportunity to introduce to you our CDC colleague, Emily Rosenfeld, who is one of the leads for the legal mapping sub-working group. So Emily, do you want to go ahead?
Sure, thank you. And I'd love to briefly address that question. I think, as colleagues have just presented as part of the, guidance and tools work stream, the Legal Preparedness Action Package has set up a legal mapping sub-working group, which is aimed at deepening the understanding of the role of legal instruments and country-specific legal frameworks in supporting legal preparedness. And the goal of this is actually to provide policy professionals, practitioners, et cetera, with the knowledge, data-driven input, and tools needed to really understand, review, develop, or even potentially revise legal authorities that are essential for carrying out global legal preparedness activities. That legal mapping as a tool can really be used to develop that information that hopefully countries can use, and if they so choose, to further work in a country-specific context to assess legal preparedness gaps and ways to address them. So in order to do this, we have been working together in the legal mapping sub-working group to develop what we're going to look at in those legal mapping studies using developed coding questions about the law, to conduct these studies, to provide those data-driven inputs regarding those activities to strengthen overall legal preparedness in those particular areas of focus. These initial questions will also form the basis of other tools, such as legal framework guides that will be developed as guidance, as resources that can help additional countries conduct legal mapping. We'll note that these studies are often kind of resource intensive, and initial studies and pilots will be expanded over time. So we do look forward to more collaboration in these efforts and, through a wide range of diverse experts on the call and in the Legal Preparedness Action Package. So thank you, and hopefully that addresses some of your initial questions from the Ministry of Health in Iraq. Thank you.
And then just
Thanks.
I'm sorry.
Go ahead, please.
No, I was going to address the second question that you read. So when it comes to health and non-health legislations, I do want to mention that we thankfully and very fortunately, we do have colleagues who work in the One Health field. So this is something that the Legal Preparedness Action Package will be looking at and developing work on that intersection, which is, as mentioned by Dr. Salama, that this, health and non-health legislations are required to face the pandemic. So that is only to say, to track the work that we will be doing, we definitely have experts who can contribute greatly to this. And I'll also mention, we have academics and we have FAO and we have OIE, involved in this, and also, the IFRC when it comes to disaster laws and how they are very relevant to responding to public health emergencies. And so we are delighted to be able to have them in as part of our working group.
Thank you so much. So in the interest of time, I'd like to thank the presenters and thank you for our colleagues who have asked questions during the session. So we'll move on to the next session titled, What is Legal Preparedness? And I'd like to introduce Professor Benjamin Meyer, He'll be highlighting the importance of reaching a common understanding of public health emergency legal preparedness. Professor Benjamin Mason-Meyer is a professor of global health policy at the University of North Carolina at Chapel Hill, a senior scholar at Georgetown University's O'Neill Institute for National and Global Health Law, and the past chair of the Global Health Law Consortium. Dr. Meyer's interdisciplinary research at the intersection of international law, public policy, and global health examines the development, evolution, and application of normative frameworks in global health law. To advance timely legal scholarship amid the COVID-19 pandemic response, he has recently launched a quarterly column on global health law in the Journal of Law, Medicine, and Ethics. Dr. Meyer received his PhD in socio-medical sciences from Columbia University, his JD and LLM in international and comparative law from Cornell Law School, and his BA in biochemistry from Cornell University. Professor Meyer, the floor is yours.
Thank you so much, Hanan. We're here because, as Anthony mentioned at the opening, we were unprepared. The emergence of COVID-19 has tested the readiness of public health law. This unprecedented threat has revealed the need to reform public health laws to prevent, detect, and respond to pandemic threats, raising an imperative for legal preparedness. And so good morning, good afternoon, good evening. I'm honored to be here representing the Global Health Law Consortium, an academic research collaborative that brings together scholars throughout the world to strengthen the laws that uphold public health. This focus on law, including legislation and regulations, has long been recognized as central to achieving health security at the global, national, and subnational levels. This legal landscape is crucial to establishing government authorities that can offer legal frameworks, policy guidance, and accountability mechanisms in preparing responses to public health emergencies. Yet, in the absence of public health law, we have seen national, subnational, and global responses hampered, raising an imperative to strengthen our laws to support public health emergency responses. The Global Health Law Consortium welcomes this opportunity to contribute to the global health security agenda by providing academic support to realize legal preparedness under this new action package. In order to promote legal preparedness in addressing this critical capacity for preventing, preparing for, and responding to public health emergencies, it will be crucial that we develop a common definition of legal preparedness. And yet, despite its importance, bringing so many of you here today, there is limited academic analysis on this subject, leaving us without explicit definitions for public health emergency legal preparedness. In framing the work of this action package to establish a definition of legal preparedness, there we go. We're building from the existing foundations of public health law and global health law, and the lessons that we've learned in pandemic responses leading up to and including COVID-19. And I hope in this brief overview to describe law as a foundation for addressing public health, to examine our past efforts to advance legal preparedness, and to recognize differences in public health emergency legal preparedness across countries, as we've discussed, giving rise to the work of this action package and the methodologies that Emily just discussed. Let me begin by framing law and the academic literature around law as a foundation of public health, essential to the promotion, protection, and practice of everything that we do. Law structures determinants of health by creating duties for national governments to translate government health commitments into lived public health realities. Law can also frame the network of institutions, norms, and processes that govern public health, strengthening governance for health. In this central role, though, law must reflect an understanding of the ways in which public health institutions work to promote health, to think about the political conditions in which the law must operate, and to think about the standards of public health science. Legislation and regulation can empower governments to secure public health, with law and policy structuring the physical and social environment that guides individual behaviors and organizational conduct. But our academic analyses have long exposed gaps in public health laws, with scholars lamenting that these gaps would undermine efforts to prevent, detect, and respond to public health emergencies, leading to the series of articles that Anthony addressed. We knew this would not work. These inadequacies in legal landscapes have obstructed national responses over the years to a wide range of public health emergencies, from SARS to Ebola to Zika outbreaks. And now we see this in divergent national responses to the COVID-19 pandemic. These divergent responses have raised an imperative, as I said earlier, to prioritize legal preparedness for future threats. Legal preparedness seeks to strengthen and coordinate the larger ecosystem of laws that are necessary to face our public health emergencies. Establishing authorities across government to promote public health by coordinating multi-sectoral responses to public health emergencies, by creating and promoting healthier environments and healthy decision-making, and in generating the information base that is needed for timely actions and policies. As seen in the pandemic response, legal preparedness across government is crucial to controlling infectious disease, crucial to securing global health at the global, national, and subnational levels. Laws that are absent, laws that are obsolete, laws that are inadequate, undermine the ability of national governments and global governance to promote public health. These gaps in national law highlight the need for national public health law reforms that are appropriate to our contemporary global health challenges. In ensuring the application of law in public health emergencies, we need to focus on legal preparedness. And public health emergency legal preparedness reflects the capability to understand, to map, to delineate, to anticipate the legal authorities that are necessary to prevent and respond to public health emergencies. It requires governments to develop, to refine, to utilize these legal instruments and their related authorities to enable the implementation of public health capacities, including in strategies to prevent, protect against, and respond to public health emergencies. Legal preparedness thus involves efforts to identify the legal approaches that can promote an effective response to a public health emergency, and to provide a foundation to reform our legal instruments, to facilitate the implementation of public health capacities that are needed for effective response. Ultimately, this legal preparedness saves critical time before and during a public health emergency. It ensures that all requisite legal capacities already exist prior to an emergency occurring, that they've been tested, that potential issues have been resolved before the emergency occurs. This is what brings us here, because public health emergency legal preparedness encourages effective and efficient legal coordination among a wide range of multi-sectoral stakeholders, helping us to plan for public health emergency preparedness in line with our global norms and standards. And yet, as many have recognized thus far, a wide range of governments lack necessary legal preparedness to respond to public health threats, necessitating this action package that we're launching today. Academic research has shown us over the years that our legal capacities remain antiquated, and they differ across nations, leading to inadequacies in existing laws and various protections across governments based upon the legislative capacity of the nation the enforcement of law, and the larger legal ecosystem that governs public health across sectors. As we begin to think about coordination across the national legal ecosystem, the COVID-19 pandemic has revealed a range of legal challenges that can arise during a pandemic response and responses to the larger set of public health emergencies, with the pandemic overwhelming our national responses, leading to unprecedented morbidity and mortality and grinding the world to a halt. As we seek to frame national legal efforts to control infectious diseases, we discuss the ways in which this legal preparedness action package will seek to develop and support nations through legal analysis, through legal mapping, assessment, and surveillance. Will help to provide country-specific legal frameworks, examining the set of legal instruments that can formally establish and integrate legal preparedness within a country. To think about the competency of officials, everyone from the Minister of Health to the communications issues that Sam addressed. Thinking about competency of these officials both inside and outside of government to apply legal instruments for public health emergency preparedness and response. To coordinate these issues, to coordinate the implementation of public health prevention, preparedness, and response across multiple sectors and across jurisdictions, and to develop implementation tools to support and guide the implementation of relevant legal instruments. Now, to ensure that these components of legal preparedness position countries well for future public health emergencies. The Global Health Security Agenda is now well positioned to promote and to advance legal preparedness through this new action package, as it seeks to build capacity at the country level to support and achieve greater global health security. If we recognize that laws are foundational to establishing national authorities to create policies in accordance with the Global Health Security Agenda action packages, then it will be crucial that we understand national legal authorities to respond to the current pandemic and to prepare for future public health emergencies. This new legal preparedness action package provides an ideal opportunity to revise public health laws in the face of unprecedented global health security challenges. The Global Health Security Agenda, the Global Health Law Consortium is honored to support this new GHSA action package. And I hope that we can remain helpful in supporting the academic foundations of legal preparedness as we begin to focus on the work to come. I look forward to your questions. Thank you very much.
Thank you, Professor Meyer, for providing a very clear understanding of what legal preparedness is and about the importance of legal foundations in public health and the need to strengthen the legal ecosystem for future pandemics. So we have time for one question. I'd like to present Ms. Sonam Shah's question. Given that there are differences in public health emergency legal preparedness across countries, how can we assess whether countries have legal authorities that ensure public health emergency preparedness?
I think this is a wonderful question and really draws upon Emily's discussion at the end of our last session. Really helps us to conceptualize the ways in which academic research can provide an empirical foundation for understanding national legal authorities, gaps in those legal authorities, and opportunities for reforms. And so as we think about the role that academics can play in this response, I'm delighted that we're able to support the Action Package leadership team in this legal mapping effort, working with students and professionals throughout the world to help us assess what areas of law are necessary in order to meet the objectives of this action package, to then be able to provide a set of specific questions that we can look to across countries to question whether governments have the legal authority in order to undertake these crucial activities. And where we see that there are gaps in those legal authorities at the national level, we can begin to assess how other countries have filled those same gaps. to provide a sense of best practices across countries for legal preparedness, and to think about how we can identify both common legal principles across countries, but also contextually specific legal authorities that are necessary to ensure legal preparedness. Academic research can provide a crucial tool to this end, and I'm really delighted that the Global Health Law Consortium is able to support this effort and to be able to provide that academic research foundation that will be crucial in understanding and assessing legal preparedness across countries. Thank you.
Thank you, Professor Meyer. And I see that we have a few more questions in the chat, but for the interest of time, if we can kindly park these, and they would definitely be addressed during the roundtable discussion. So moving on to the roundtable on legal preparedness challenges, I'd like to introduce my colleague, Ms. Isabelle Granger, as the moderator for the roundtable discussion on legal preparedness challenges. Ms. Isabelle Granger joined the International Federation of Red Cross and Red Crescent Societies in 2005. In her current capacity, she manages the Policy and Disaster Law Unit and supports the development of legislative advocacy initiatives by the IFRC network. Previously, Ms. Granger served as IFRC Disaster Law Coordinator for the Americas from 2009 to 2016, as IFRC Senior Legal Advisor to the Tsunami Operation in Southeast Asia from 2005 to 2009. Ms. Granger earned her graduate degree in civil law from the University of Montreal in 1999, her Juris Doctorate from the University of Ottawa in 2001, with distinction in all subjects, and her master's degree in business administration from HEC Montreal in 2003. She's a registered lawyer at the Quebec Bar in Canada since 2001. Ms. Isabelle, the floor is yours. Thank you.
Thank you, Dr. Hanan, for this introduction. I would also like to thank Argentina, the O'Neill Institute for National and Global Health Law, and the United States for their kind invitation to participate in this important event and chair this panel. Excellencies, distinguished panelists, ladies and gentlemen, my colleague, Professor Meyer, has provided important arguments on the importance of being legally prepared and the role of law and policy in responding to public health emergencies and in protecting communities in an equitable way. As the COVID-19 pandemic has demonstrated, levels of success in using legal and policy instruments to respond to the pandemic have varied widely across the world, and not always in the most expected ways. In some cases, existing laws and policies have proven to be outdated or inadequate by more than a century. In others, there was a lack of alignment between different types of frameworks. I could go on, but our panelists will illustrate this point from their various institutional and sectoral perspectives in a few minutes. In this panel, we will welcome important guests who will share with us their practical experience, lessons learned, challenges, and recommendations in order to help other countries, organizations, and colleagues in their efforts to become legally prepared to face public health emergencies. IFRC is particularly interested in the discussion of this panel. Indeed, through her work on disaster law, the IFRC has over 20 years of experience providing technical advice to governments on how to develop and implement effective disaster laws. And I want to emphasize this because it matters for many of the global reform discussions we are having right now. Epidemics and pandemics are a type of disaster. They may have characteristics of their own that are not shared by other types of disasters, but they do have a lot in common with them as well. And to treat them in silos has risks that have been borne all too clearly by the COVID pandemic. As hazards increase in frequency and intensity, we can expect there to be not only less time to recover between them, but also multiple hazards happening at once, resulting in compounding risks. In 2021, IFRC analyzed the role of law and policy in supporting preparedness and response to public health emergencies, with a focus not only on the COVID-19 pandemic, but also on other public health emergencies in recent history, such as the outbreaks and epidemics caused by the Ebola, Zika, SARS viruses. The findings of the report indicate that urgent action is needed to strengthen domestic laws and policies for public health emergencies and to protect the most vulnerable in need. Based on the findings of the report, IFRC has produced a guidance document entitled Guidance on Law and Public Health Emergency Preparedness and Response, which will provide a valuable resource for governments embarking in this endeavor. The IFRC strongly believes these recommendations can contribute to the important discussion we have had over the past year within the WHA and other key intergovernmental platforms, where we have several key opportunities to strengthen and ensure better alignment of legal frameworks at all levels. As such, it is important we all coordinate lessons learned and hear the thoughts of the panelists on how we can legally prepare for the next public health emergency. Without further ado, let me introduce our distinguished panel, who will be presenting best legal practices and lessons learned. Dr. Abdoulaye Camara is the Public Health Emergency Preparedness and Response Coordinator from the Gambia Ministry of Health. He has worked with the Ministry of Health in the Epidemiology and Disease Control Unit for almost 30 years. As part of his current work, he partners with UN agencies, other ministries, the private sector, media, and other in order to advance preparedness and response work. He doubles as the Emergency Operations Center Manager and National One Health and GHSA Coordinator, leading trainings for surveillance officers on disease surveillance and control, and facilitating sample collection and transport without National Health Laboratory. Dr. Maria Chiara Campisi is the Program Coordinator for the Health Law Program in IDLO, the International Development Law Organization, and coordinates IDLO work on public health emergency preparedness. She's an Italian lawyer with a background in public international law and international human rights law, and holds a PhD in law from the European University Institute. In IDLO, Maria Chiara has worked at the intersection of the rule of law, public health, and sustainable development. Maria Chiara has worked with international and regional institutions, non-governmental organizations, and academia in research, policy, advocacy, and program management in various regions, including Latin America, the Caribbean, Africa, and South Asia. Dr. Jason Chu is a mathematical modeler and biostatistician. He works for the Current Disease Control and Prevention Agency as Deputy Scientist Director in the Division of International Affairs. He has been responding to the COVID-19 since January 1st, 2020, when the Republic of Korea identified a pneumonia cluster with unknown etiology in Wuhan, China. He was involved in all Korea's risk assessment of this unprecedented public health event and served as IHR national focal point of the Republic of Korea. He has been a GHSA coordinator in Korea since 2014. He has served as an international panel of experts in GHS Index since 2017. Giacomo Di Federico holds a master's degree in EU law from the University Paris 1 Panthéon-Sorbonne and a PhD in EU law from the University of Bologna, where he is a full professor of EU law. Since 2007, he has been a member of the Research Center on Health Law. His main field of interest are EU constitutional law, healthcare, and fundamental rights. And finally, Senaid Teketse Fekadu, and I'm sorry if I'm not pronouncing this well, he works for the World Health Organization Regional Office for Africa as technical officer for the Emergency Operations Center within the WHO Health Emergencies Program. She leads the WHO functions in implementation of Public Health Emergency Operations Center in the WHO Africa region. She proactively worked with member states and all relevant partners to coordinate establishments and operationalization of these centers in the Africa region. And she created the regional network of PHE Operations Center, and this network is instrumental in the development of norms and standards during sharing information, experiences, and best practices among partners. So it is now time to hear from our distinguished panelists. So before I begin, I would like to ask the panelists to keep your answers to the time we anticipated, as we have a lot of questions and the time is short. We might have time for questions and answers as well. I will beg for your forgiveness in advance for having to take the ungrateful role of timekeeper if you go too much over time. And I have prepared this drawing and I will show it to you when your time is up, and I would appreciate if you could then conclude your remarks. So the first question, so it's a question for all panelists. If you could please let us know in just a minute, why has your country or institution decided to join the Global Health Security Agenda Legal Preparedness Action Package? Let's start with Dr. Camara, please.
Thank you very much, and for the invite and welcome. The Gambia is a developing country, and being part of the global network, we thought it is very important to join the global health security agenda so as to learn from our colleagues the work that they are doing in order to emulate them and see to it that our health systems, our PHEOC is at the level where other countries are, and to build capacities in our country so as to see how best we'll be able to get the legal backing to move the public health emergency preparedness and response forward. So we are learning from our colleagues, we are listening carefully, and we are trying to make sure that we bring the experience and back in our country and to move forward through the One Health concept. Thank you.
Thank you, Dr. Camara. Can we next go to Dr. Campisi, please?
Thank you, Isabel, and thanks to the Legal Preparedness Action Package co-chairs for having me here today. Perhaps let me start with a bit of background on IDLO and its mandate, and I'll be brief, Isabel, I promise, because I think that this explains well our commitment and alignment with this initiative. For those who may not be fully familiar with IDLO, the International Development Law Organization is the only global intergovernmental organization dedicated to promoting the rule of law to advance peace and sustainable development. So in the context of global health, building on our mandate on the rule of law, we promote the role of the law as a tool to advance public health and health security, including by preventing and responding to disease outbreaks, which may amount to threats to global health security, such as the COVID-19 pandemic. So based on our experience, we believe that sound legal and policy frameworks are key enablers in ensuring effective prevention, detection, and response to public health emergencies. And in our work, we've learned the importance of building and strengthening legal capacities at all levels to respond to future health crises, as we heard before. In the past years, we've seen that although the current pandemic has certainly raised awareness at the global level on the importance of legal preparedness to prevent, detect, and respond to public health emergencies. In fact, countries often struggle to design, develop, implement, and monitor supportive legal frameworks for emergency response. And this is mostly due to limited legal capacities at national level. So on these basis, IDLO, in collaboration with WHO and other partners at global and local level, we support low and middle income countries to strengthen legal frameworks for public health emergency preparedness in compliance with their obligation under international law. And we really work with them to build legal capacities. So by joining the Legal Preparedness Action Package, IDLO contributes to the global commitment to strengthen global health security by promoting the rule of law. And we work with partners to raise awareness about the importance of applying rule of law solutions to prepare and respond to future public health threats. Thanks.
Thank you, Dr. Campisi. I would now like to give the floor to Professor Di Federico for your remarks.
Yes, thank you. Well, the pandemic has demonstrated how dramatically important it is to be ready and able to react to public health emergencies, regardless of their origin, keeping in due account, of course, the multifaceted issues and problems that they pose at the local, national, regional, and international levels. In particular, above and beyond human resources, financing capacity, and technological development, legal preparedness has shown to be a fundamental component of the overall preparedness of a country. Now, Italy has long been involved in the process of advancing in this field and reviewing and adjourning the laws and regulations that enable and favor a quick, efficient, and effective response to health threats. Indeed, preparedness, as we know, is not so much a result, but a process. And in this sense, Italy recognizes the added value of cooperation and cross-fertilization within the European Union and the World Health Organization, and thus views its participation in the Legal Preparedness Action Package as a way to maintain and increase its response capacity and to contribute to the improvement of public health protection.
Thank you for your remarks. I would now like to give the floor to Dr. Chu, please.
Thank you. Republic of Korea have consulted many countries during the early phase of the COVID-19 pandemic. The two common factors were distinguished among the questions we have. That is the testing capacity and the contact tracing. They had no problem to accept Korean policies to enhance their testing capacity, but the contact tracing was a quite different matter. Their legal systems were not prepared to trace and contact as Korea did. They simply had no legal basis to trace the contact information along with the appropriate method. Korea has prepared for this kind of the outbreak and responded with the legal way since 2015. Actually, legal preparedness is a basic element to effectively prepare for and respond to emerging infectious disease outbreaks. So when you heard the GHSA launch a new action package on legal preparedness, we strongly felt it is a high time to share our real-world experience with other countries. Over to you.
Thank you, Dr. Chu. And finally, Dr. Fekatu.
Thank you, Isabel. Good morning, good afternoon, good evening, colleagues. While I cannot speak for WHO as a whole, but I'm excited to see the work of the Legal Preparedness Action Package, particularly with the emphasis of the role of legal preparedness for emergency response through Public Health Emergency Operations Center. Recognizing the powerful role that the legal instrument can play overall for emergency preparedness and response, particularly in the context of Public Health Emergency Operations Center development and operationalization. WHO, AFRO, in collaboration with the key partners, have been supporting countries to develop a legal framework for emergency operations center, because the legal having an EOC established by a legal authority enables operation of the EOC and allows, is recognized as one key pillar for having an operational and functional EOC. So as we continue to support countries, I'm excited to learn through the Legal Preparedness Action Package of additional opportunities for enhanced collaboration, both at regional and country level.
Thank you. I think this is already very interesting, and I like the quote as well of Dr. Di Federico saying that legal preparedness is not the result, but the process. So very, very true. And as well, all the practical aspect of legal preparedness, very interesting already. We would like to hear more from you, and let's go to the next question. So in the next question, I would like to ask Dr. Camara and Dr. Campisi to tell us more about some specific legal challenges that have come up in your countries, and which of these would you say are the most important ones? Can we please start with Dr. Chu, please? Dr. Chu, can you please put your mic on?
Actually, I sent the presentation file, so it would be appreciated if you turn it on. Thank you. Republic of Korea has experienced the MERS-CoV outbreak in 2015. So we had 186 casualties and 38 deaths. It was a great shock to Koreans public health authorities, and so we have gone through all the public health emergency response system reforms. Okay. Yeah, just before. And the Republic of Korea has gone through a series of legislations to support the National Public Health Emergency Response System reform, which was launched in December 2015. It aimed to provide a system capable of rapid response to emerging infectious disease outbreaks. Major changes is to establish 24-hour EOC rapid response teams, on-site disease control center, and risk communication team, along with risk assessment team in KCDC. We are to establish operating systems for the early diagnosis and case isolation facilities and specialized treatment systems. We also develop a integral information system to manage surveillance, epidemiological investigation, case isolation, and context quarantines. We found the gap in dealing with the hospital-associated infection during 2015's MERS-CoV outbreak, so that we have changed infrastructures in hospitals. We put mandates screening stations in emergency rooms. We expand the infrastructures to strengthen the infection prevention and control. And we have to change the culture of nursing and visiting partners in hospitals. We noticed that the governance is important during the MERS-CoV outbreaks in Korea, so that the level of cases directed can serve as a control tower in outbreak response during the emergencies. Okay. One of the successful elements in the preparedness and response for emerging infectious disease outbreak is that we have provided concrete legal basis by amending the relevant laws. We had established what designated infectious disease specialty hospital nationwide. These specialty hospitals can handle all the aspects of the preparedness response. We have compensated for loss of the medical institutions because of the ward closure and suspension of the treatment. We can mobilize the medical personnel during an emergency or on temporary basis to conduct disease control duties. We provide financial support for the case and context in isolation or quarantine by providing livelihood assistance and child care support, and encourage the employees to provide paid leave to the cases and the context. Next, please. We also have changed the national notified infectious disease. It has revised based on the severity and transmission rate and the level of isolation. So we have now 86 infectious disease to notify in Korea. Class 1 includes the high case fatality rate or high risk or mass outbreak disease such as MERS, Ebola, and COVID-19. Next, please. So we have gone through and still maintain successful separation strategies through the change of the laws. However, we have found some gaps in respect to COVID-19, so we have suspended suspected cases for facilities quarantines. So actually, in 2020s, we have gone through a lot of the amendment of relevant laws. Next, please. The challenges. Although the Republic of Korea has responded to COVID-19 with a regular basis, still it faces some challenges to handle. The privacy is once again the hard issue. So we have solved this issue by erasing all the cases and the medical institution information on the web when a certain amount of time passed. For the first time in Korea, vaccine hesitance matters during a massive immunization of the COVID-19 vaccines with after effect following immunizations. We are certain that this vaccine hesitancy is a worldwide situation, and we are considering these issues as one of the agendas that we can discuss with the GHSA members at the Immunization Action Package webinar, which will be held in 13 April. Next, please. I will touch the lessons learned so far. Korea has successfully contained the first phase of the COVID-19 2020s. That's from the lesson learned from the MERS-CoV outbreak in 2015. We early detected the first imported cases and conducted a rapid response. We have secured sustainable financing, which led to public conformities. Information sharing is timely and transparent, and which led public support. To make all these mitigation efforts with the governments, we noticed that the continuous revising the laws and regulations are necessary. Thank you.
Thank you very much for your remark, Dr. Chu. I would now like to give the floor to Dr. Campisi, please, for some remarks.
Thank you, Isabel. I can share some experience and lessons from the work that IDLO has been doing in supporting countries to strengthen national legal frameworks for public health emergency under the Pandemic Preparedness and Response Project, the PPRP, that we initiated in 2020. So the Pandemic Preparedness and Response Project, the PPRP, was designed to address what we found to be two of the key bottlenecks to effective public health emergency legal preparedness at country level. That is, on the one side, weak national legislations on public health emergencies, as Anthony depicted in his keynote remarks, and also as we've just heard from Dr. Chu. And on the other side, the lack of local capacities to understand and use the law as a tool to prevent, manage, and respond to public health threats. So from the pilot phase of the PPRP, which initially focused on Zambia and Uganda, there are a few overriding considerations. First of all, it's important to keep in mind that legal preparedness is a result of a complex and long process. This process may require policy and legal reforms, the establishment or the strengthening of legal infrastructures, the operationalization of effective procedures and processes, and so on and so forth. And this complex process really requires a high level of collaboration, understanding, and support from a broad range of stakeholders, which are called to work together. I saw a question on the chat about that. Absolutely, multi-stakeholder coordination. But this multi-stakeholder coordination, in turn, requires a solid understanding about the role of the law in advancing public health and health security at different levels and in different sectors. So for these reasons, I think that a significant investment in capacity building for local stakeholders in different sectors on the intersections between law and public health, including in case of emergencies, is really a first component for a meaningful intervention to strengthen legal preparedness. The second consideration, which somehow stems from the first, is the need for a whole of government approach in advancing legal preparedness. Public health emergency legal preparedness, including the process for strengthening legal frameworks, cuts across all sectors and departments and requires, again, strong, ongoing intersectoral collaboration. From the work with the PPRC, we've seen that this process, when meaningfully done, can be itself a tool to enhance coordination among different government sectors and can, in fact, enhance their understanding about the need for effective legal frameworks and mechanisms. So legal preparedness also as a process itself. The third and final consideration is the need for engaging society and communities. The experience with COVID has taught us dramatically that the effectiveness of public health measures and public health systems deeply relies on the buy-in of communities. And this is even more so in case of public health emergencies. However, at the same time, we've seen that during a crisis, sometimes it's not possible to ensure full participation in emergency decision-making. So there is where the law comes, where effective public health legal frameworks can ensure participation and involvement of the society, both during the planning and in the implementation of these measures, in line with human rights principles, and in particular, the principle of participation. So in this way, when the time comes, these measures will find legitimacy and support among the people. So in this sense, the role of local civil society organizations, community-based organization, academia, I was saying in the chat a moment ago, was a space for academia, a huge one, and I'll address it in a moment as well later on. All these actors have really a key role in ensuring social mobilization, participation, and support to the policy process, and to support the legal measures that eventually are adopted during a crisis. And this also addresses, I think, one of the questions that was raised before on the policies, how to navigate policies. These actors will have a huge role in navigating, adversing policies in a way. But to allow all these actors to meaningfully engage and contribute to these processes, dedicated capacity building is needed also for these groups. And these bring us back again to the first point, the need for structured capacity building and awareness raising at all levels. I'll stop here and I'm happy to elaborate a bit more later.
Thank you, Dr. Campisi. I would now like to give the floor to Dr. Camara for some remarks.
Very good. Thank you once again. The Gambia, we've started looking at our legal framework in November 2019, when it was first drafted with the help of a WHO consultant, Dr. Abdoulaye Bousso from Senegal. What we are trying to do right now, what is one of our main objectives, is to look at the core public health institutions in the Gambia, including the University of the Gambia and all other health training institutions. And we are moving forward, including other partners and the private sector as well, to look at our legal institutions. How best can we update the legal framework? How best can we sensitize our politicians? Because it has come at a time when it has coincided with the presidential election and also the legislative election, which is going to be held next month on the 9th. And we are hoping that after the legislation elections, we are going to put the parliamentarians together, sensitize them to know exactly what are their roles and functions when it comes to the political motivation, in order to make sure that we have a level playing field as far as the execution of public health emergencies are concerned. So this is going to be one of our focus areas, and making sure that the politicians go forward and make laws that are going to help us sustain the legality and the backing of the Public Health Act and also the PHEOC legal framework. Thank you.
Thank you very much, Dr. Campera. I really like the remarks provided by the panelists in this in this first segment of the session. I mean, noticing that there's many laws already that have been adopted in this pandemic. What was highlighted as well is the need for a whole of a society, whole of government approach, including the important role of societies and communities, which also have a very important role to play in preparedness and response to public health emergencies, and as well the importance of implementing the laws and the capacity building of stakeholders. This is very interesting. So let's continue with the second, another questions, now directed to Dr. Ficadou and Professor Di Federico. You both work at the regional level and with all the coordination issues that this entails. So can you tell us about the lessons you have learned from this and past public health emergency when it comes to laws and regulations, and what are your recommendations? Dr. Ficadou, the floor is yours.
Thank you very much, Isabel, again. Before going into lessons learned and challenges, I will give you a little background of the work done at regional and country level. WHO published a framework for Public Health Emergency Operations Center in 2015 that serves as a guide for establishment and strengthening of EOC to improve emergency management. The framework was developed following systematic review and is evidence-based. So the framework emphasizes the critical importance of having a legal framework for Public Health Emergency Operations Center that allows development and operationalization of a Public Health Emergency Operations Center. Then in 2018, realizing the critical need for having detailed guidance at regional level, we published a guidance document, namely a guide for the development of a legal framework to authorize the establishment and operationalization of a Public Health Emergency Operations Center. These tools were instrumental in guiding member states establishing public health EOCs by legal authority. To just give a little highlight on the development process, At regional level, we formed a multi-agency technical working group encompassing different partners, regional and global partners. And we drafted the document and we called upon national EOC members to review, validate, and finalize the document so that it is country-led. Then following the publication of this document, we conducted a regional train-the-trainer, bringing experts from national level, train them through and how they can adapt this document at their respective countries. But also we used these experts to deploy them to other countries to adapt this document at country level. And I would like to reiterate what Dr. Abdullahi Kamara from the Gambia said. It's this document that they have adapted at their country, and we deployed an expert from the Senegal, which is one of the well-functioning EOCs, went there, supported the country to adapt their document at country level. So this allows exchange of experience and best practices across different countries in the region. It's evident that legal framework provides EOC an authority and a mandate to operate, and also define clear roles and responsibilities. So the legal framework document encompasses 12 domains, 12 areas. And then I will mention some of them. It includes authority for activation, deactivation, accountability and reporting, financial resources for emergency management, medical countermeasures and personal deployment, and so on and so forth, and leadership and authority for decision-making to take actions for the EOC operations. So this is the framework. So now coming back to the lessons learned, we've learned that EOC with no legal authority lacks mandate to operate, and continuous advocacy to increase awareness on establishment of EOC with legal mandate is crucial. And Dr. Kamara highlighted that they still have difficulties, and they will be sensitizing their leadership and authority on this. So this is an experience across different countries. Second is multidisciplinary approach at regional level. With vast experience from across different regions was a best practice. So we have the technical working group from regional and international partners, and we have this vast expertise coming together in an innovative approach to advise countries on establishment and operationalization of EOC, including establishing countries by legal authority. Third lessons learned is having a regional trained team of experts through regional train-the-trainer program were beneficial in developing legal framework at country level. Experts were deployed by different organizations. So what we did was we jointly trained these trainers, and these trainers were instrumental to push this agenda forward at country level. To just mention some challenges, in the past years we have witnessed the EOC with no legal framework, lacks mandate and clear defined roles and responsibilities, and this several times led into duplication of preparedness and response efforts and absence of required authority to make decisions, and conflict among different departments which hamper emergency management. And besides, sustainability of the EOCs were challenged in the absence of legal authority. So another challenge was delay in approval of legal authority, which was also mentioned by the Gambia. So these are some of the challenges faced in implementing a legal framework for EOC at country level. Over to you. I turn over to you, Elizabeth. Thank you.
Thank you, Dr. Fekelu. I would now like to pass the floor to Professor Di Federico for some remarks as well.
Thank you very much. Let me start by saying that the Union, or reminding you that the Union enjoys limited competences in the field of public health, the organization, management, and funding of the national healthcare systems remaining firmly in the hands of the member states. By and large, the Union complements, supports, and coordinates the action carried out at the national level. Now, since the 90s, however, the EU institutions and the member states have recognized the need to further epidemiological surveillance and control of communicable diseases, and a lot of progress has been made over the last 2 decades, especially after 9/11 and the fear of chemical and biological weapons, of course. Now, taking stock of the experience sadly gained during the swine flu, cholera outbreak, Ebola, and Zika, the Union has focused on setting up a common response. Now, the Lisbon Treaty of 2009, which profoundly reformed the Union in terms of institutions and competences, introduced some important amendments which facilitated advancements in the management of cross-border health threats. In particular, besides strengthening networking and governance instruments, EU law promoted surveillance, information sharing, and reporting in this domain. Early warning and response systems, rapid alert mechanisms, and laboratory networks have been foreseen and regulated, and member states have specific notification duties in this regard. Moreover, procedures have been elaborated to guarantee access to essential goods throughout joint procurement agreements and authorizations on exports. Coordination, technical assistance, and capacity building are also promoted in a spirit of solidarity, going back to what was said before, especially through the civil protection mechanism, most notably within the context of natural and man-made disasters. The action undertaken at the supranational level has effectively forced the domestic legislators and administrations to endorse an all-hazards approach and develop a more coherent set of rules to tackle cross-border health threats, which has undoubtedly contributed to their legal preparedness on many levels and in many respects. It has also drawn the attention to the need to achieve better coordination within the national healthcare system between the central and local levels in order to react promptly to emergency. So now I can touch upon recommendations, or better said, lessons learned and recommendations for supporting countries in building greater legal preparedness. Now, I believe the best way to frame and fully appreciate the reaction of the Union to the pandemic is precisely to look at how it tried to further boost legal preparedness at the national level. The sanitary crisis made the national governments appreciate the need to further monitoring, reporting, sharing, and processing relevant data. Timely, concerted, advised, legally grounded response to the effects of the virus, most notably when adopting restrictive measures, is, of course, of the utmost importance, I would say also and especially from a constitutional law viewpoint. And here we go back to the issue of rule of law, of course. The adoption of those restrictive measures and their enforcement, of course, is left to the single member states. But in order to be effective, the response has to be adequately coordinated and implemented within a broader strategy determined at the supranational level. In truth, I would say the main takeaway of the pandemic is the added value of regional cooperation in the field of health, and most notably of legal preparedness. The importance of the supranational dimension, which had already been tested and proven effective in recent past, was confirmed and highlighted by COVID-19. The magnitude, I think, of the phenomenon led the member states to fully realize the potential of a more coordinated and informed response. The number of formal and informal high-level meetings grew significantly with the realization of the severeness of the threat posed by the virus, and formal limitations notwithstanding, member states discussed sensitive issues like the introduction and modifications of restrictive measures. The idea of health union put forward by the Commission in November 2020 precisely builds upon the conviction that sharing knowledge, information, and resources at the supranational level enhances quality of treatment, access to services, resilience, and sustainability of the healthcare systems of the member states. It is within this conceptual framework
that the Commission came forward with a number of proposals to strengthen the European Centre for Disease Prevention and Control and the European Medicines Agency and their capacity to ensure access to reliable and comparable data, as well as to create a health emergency preparedness and response authority inspired by BARDA in the United States. However, HERA is an internal service of the European Commission dedicated to prevent, detect, and rapidly respond to health emergencies, in particular by focusing on the development, production, and distribution of medicines, vaccines, and other medical measures. Now, in this respect, I don't need to remind you that EU countries were really struggling to obtain gloves and masks during the first phase of the sanitary crisis, and that is what obviously inspired the Commission. Now, these reforms have already been realized, together with that concerning strategic stockpiling under the civil protection mechanism, and others are in their final phase list. Amongst the acts currently under review, the legislation on serious cross-border health threats deserves particular attention, I believe, insofar as it lays down the core elements of effective cooperation in the event of future health emergencies, namely a comprehensive and transparent framework for reporting and auditing, improved data collection tools and the use of artificial intelligence, and the activation of union emergency mechanisms for the management of health crises. And although these rules do not harmonize national legislation, they do establish precise obligations and set clear objectives in terms of legal preparedness at the national level. I think I'll leave it there for the moment.
Thank you very much, Dr. Di Federico. So I see there are many questions in the chat. However, I think that many of these questions have already been answered by the panelists. There's, however, one question that I believe has not been answered. Dr. Pisi, you've talked about the importance of multi-stakeholder partnership, but could you provide some example of why it's so important, please?
Thank you, Isabel. Very briefly, and I note Anna's response right now in the chat. Thanks, Anna. I think there are a number of examples where multi-stakeholder partnership is relevant in the response to public health emergencies. And these can be both at the government level, so within different sectors of the government. Think, for instance, of collaborations in terms of data protection that we're seeing for restriction measures during COVID-19, for instance, in the need of ensuring coordination between deputed officers related to the management of data and accessibility of those data by Minister of Health or Public Health Emergency Operations Centers and so on and so forth. And this could be an example. Another example, of course, and this is quite evident, is in the area of One Health, the need for collaboration of the veterinary institutions and organizations with Minister of Health, the food dimension, and so on and so forth. Within different sectors, what I was referring before, the need of bringing in societies and communities, working together with governments and having academia contributing to that is essential for the sustainability of these measures and acceptability of these measures. This is the first point. The second point is essential also in terms of accountability. Once these measures are taken, how to make decision makers accountable for those measures. In these things, having engagement of different stakeholders is key to ensure that there is a systems that ensure sustainability and enforceability of these measures, but also accountability of decision makers in the long term.
Thank you very much. This is very interesting. I also have another question here. So there's a question from the chat. Will there be a need for emergency legislation during a pandemic when this action package is in place? Would any of the panelists have a reflection on this? And maybe we close with this question. So maybe I can ask Dr. Fikadou from the WHO.
What was the question again? Can you come again?
So if there will be need for emergency legislation when the action package is in place?
Yes, I think it's important to have a legislation for emergency management. This is what we are trying to do through the public health EOC, having established by its legal authority, really drives the emergency management throughout the emergency management cycle, from preparedness to response and recovery.
Thank you very much also for keeping your answer short. So I would like to conclude today's panel with some closing remarks. Firstly, to thank our distinguished panelists for joining us today. It has been very interesting to hear our panelists' perspective on the importance of law and policy in supporting public health emergency preparedness and response. It is clear from today's panel discussion that there's an urgent need to strengthen legal and policy frameworks for public health emergencies. We were not sufficiently legally prepared for the COVID-19 pandemic, but we now have an opportunity to learn lessons from this crisis and be much better legally prepared for the next major public health emergency. To be legally prepared, we need to review and update our laws, policies, and contingency plans to ensure they are comprehensive, inclusive, and practically effective. Law and policies and contingency plans must specifically address the protection of the most vulnerable people and communities during public health emergencies to ensure they are not left behind. IFRC anticipates that the COVID-19 pandemic will be a catalyst for legal reform at the domestic level. We anticipate that legislative review processes will soon be underway in many countries around the world, and we've already heard from Korea that they have adopted many laws in the response to the crisis. IFRC, together with National Red Cross and Red Crescent societies, stand ready to assist government in working on legislative review processes to improve their legal preparedness for future public health emergencies, and of course continue collaborating with this action package. I would now like to turn back to Dr. Hanan for the last segment of this session. Thank you.
Thank you, Ms. Isabel, much appreciated. We'd like to hear closing remarks from our colleague, Dr. Jose Fernandez, who will help us bring this event to a close on behalf of one of the co-leads of this action package. Dr. Jose Fernandez serves as the Acting Director for the Office of Pandemics and Emerging Threats with the Office of Global Affairs at the U.S. Department of Health and Human Services. In his role, Dr. Fernandez provides leadership and advice on strategic policy, planning, budget, and management issues across 4 thematic areas: global health security and sustainable financing, influenza and pandemic preparedness, antimicrobial resistance and One Health, and emerging infectious diseases and response policy. He supervises a diverse group of civil servants and fellows representing public health and scientific professions, oversees policy development and implementation, and represents the OGA and HHS in USG interagency policy processes in bilateral and multilateral fora, and with non-governmental and private sector partners to promote and advance global health security policy and diplomacy objectives. Dr. Jose Fernandez, the floor is yours.
Thank you so much, Hanan. And I want to thank first the GHSA chair team, the Action Package Coordination Task Force, the Advocacy and Communications Task Force, the Legal Preparedness Action Package Leadership Team, and all of the speakers for helping to make the event here a successful launch of this action package. Standing up an initiative on legal preparedness is a priority, frankly, for the US government, and GHSA is the mechanism that can really provide a clear path to advance this important work. And so, again, I really want to thank everyone's participation and attendance here today in this important event. As mentioned throughout the event, time and again, public health emergencies have shown how legal challenges can actually stand in the way of a rapid response, and also effective preparedness when they could have been minimized with a legal infrastructure in place at the country level. And yet we have not yet taken advantage of previous opportunities to explore how best to enhance legal preparedness as a critical capacity for health security. If we are legally prepared, we can save time during a public health emergency. And most importantly, we can save lives, since every minute really does count. By ensuring that legal capacities are in place, we can focus our efforts on other critical dimensions of a response. So today, we reached our first major milestone, the Action Package's first promotional event to bring greater awareness about legal preparedness and introduce this important global initiative to the larger global community. The work is just beginning, and there are certainly exciting opportunities ahead of us to engage with and support countries in strengthening their legal preparedness. From defining the capacity itself, to developing technical tools, to holding public events like this one to bring greater awareness about different aspects of legal preparedness. For example, we've already begun planning for a webinar on liability risk management and hope to hold a webinar on legal mapping in the near future. We'll also be holding workshops on liability and on legal mapping in the upcoming Global Health Security Conference in Singapore in the summer, and which will enable us to advance further our work in these areas. This is only the beginning, and we have much more in store. So those who are interested in finding out more and following us should email the Legal Preparedness Action Package Executive Secretariat. I think we'll have the contact information in the chat. So once again, thank you to all the participants for joining today. And I encourage you to follow us, to remain engaged, and to work together with us to advance this important area of work. Thank you again so much.
Thank you, Dr. Fernandez, for the sincere closing remarks and for thanking the organizers, the speakers, and the participants. As our colleague Catherine has written in the chat, if anyone is interested in joining the Legal Preparedness Action Package, feel free to reach out via email. And if you missed the email in the chat box, it's also located on the web page. Thank you to everyone for joining today, and congratulate the Legal Preparedness Action Package leadership team for a successful launch. Thank you, and we look forward to your active participation in future events. This concludes today's session.
Thank you.
Thank you.
Thank you. Bye-bye. Ciao.
Thank you.